Athens. It's nice to see you in the office again today. We are going to be completing a chest, lung, and heart assessment for today's video. So I'm going to be just talking out loud about normal findings. If you have any questions, feel free to ask. And I'll be taking some notes on the findings that I have for documentation purposes later, okay? All right, so to get started, I am going to do the overall inspection for the chest, lungs, and heart kind of all at once. So the first thing I'm going to do is we are just going to take a look at the patient to check their posture. A lot of times posture can be indicative of their breathing patterns and status. So a lot of times you'll see tripoding or someone hunched over if they're having a hard time breathing. His posture is nice and upright, what we would anticipate. We can also look at the anterior to posterior and lateral ratio of the chest, whereas the anterior to posterior should be a 2-to-1 ratio. Anterior to posterior should be a 1 ratio to the lateral, which would be a 2 ratio. At the same time, I am just kind of looking at his chest and seeing if there is any visible pulsations from the heart. He does not have any that I can see through his chest. We are also going to take a pen light at this point, and normally I would have the patient somewhat supine for this, or at least reclined at a 45-degree angle. We do not have an exam table here that does that, so we're going to pretend the patient is lying back. And here we should be able to see the jugular vein for any distension if there was any at that point. You can also a lot of times see the pulsation through there. On a young, healthy individual, a lot of times you will notice the pulsation at the suprasternal notch. But I am going to use my tangential lighting to see if I can see, go ahead and try back a little bit for me, to see if I can see any of those pulsations. And I'm also looking for distension as well. And I will look from this side too. And I do not see any distension. All right. You're also going to be inspecting landmarks at this time. So you're looking to make sure that the trachea is midline. We already commented on the suprasternal notch. And then the angle of Louis, which is going to be at the sternum down here. So on inspection, everything seems to check out. Next, I'm going to go ahead and palpate the carotid pulses. And I'll do one side at a time. As I do this, I am feeling for any pulsations or thrills is what they would call. If you do feel a thrill, then you would definitely want to auscultate those. We are going to go ahead and auscultate the carotid pulses as well anyways, with both the diaphragm and the bell of the stethoscope. Okay. And then next we're going to go ahead to auscultating the heart sounds. So I am again going to listen with both the diaphragm and the bell, but I'm going to start with the diaphragm. We're going to start on the right side, on the sternum, on the second intercostal space is going to be the aortic area. And on the left sternal border, second intercostal space, you have the pulmonic area. We're going to move down to the third intercostal space to listen for Erb's point. The fourth intercostal space for the tricuspid area. Down to that fifth, and then if you go to the left midclavicular line, in that fifth intercostal space is where you will find the apex of the heart. I'm going to repeat that with the bell of the stethoscope. I'm also going to have the patient take a nice deep breath here as I'm listening for those heart sounds. And lastly, I'm going to have the patient lean forward and I'm going to repeat that again. And you can just breathe easy for me. Okay, so we do have the patient lean forward to listen for any murmurs. They typically can be heard easier that way. As we are auscultating, we're listening for regular S1 and S2 heart sounds. We're also listening for any extra like S3 and S4 heart sounds or those murmurs. Sometimes when the patient takes a deep breath, you'll be able to hear a split S2, which is why I instructed him to do that. That's going to be your aortic and pulmonic valve closing at separate times. Those were all absent. I just heard regular S1 and S2. So we're going to go ahead and also palpate those areas that we said. And here I am just feeling for any lifts or heaves, which would actually be a pulse of the heart strong enough to lift my fingers and my hand with his chest. I do not feel any of those. Just regular pulses here. Okay, great. All right. Then we're going to go ahead and finish up this assessment with the lungs, with the rest of them. So I'm going to start with the lungs, and I'm going to have you turn, and we're going to listen to the back first. So we're going to go ahead and listen to all of the lobes of the lungs here. Go ahead and take a deep breath for me. Great. And in the back, we should be listening for bronchiovesicular and vesicular lung sounds. I'm also going to go ahead and use my hands to check the symmetry of his chest movement as he breathes. So by doing that, my fingertips are going to be pointed towards his armpits, and I'm going to take my thumbs and kind of pinch up right over the spine, having the patient sit upright with his hands at his side. I'm going to have him take a deep breath. And again, I'm just checking that my hands symmetrically move up and down together. So we did the auscultation, we checked the chest symmetry. We're also going to go ahead and do percussion for this and palpation. So for the percussion, I'm going to go ahead and go over each lobe, and again with my anchoring hand and my hammer hand. And we should be hearing a resonant tone. And that sounds good to me. We're also going to go ahead and move on to palpation. So the purpose of palpation is going to be listening when the patient speaks to see if there's symmetry in the pulsations I can feel through my hands. The best way to test that is going to be the ulnar surface of our hands that feels vibration the best out of any area on the hand. So I'm going to instruct the patient to say blue balloon 3 different times as I move up his back. And you can go ahead.
Blue balloon. Blue balloon. Blue balloon.
And again, I'm feeling to see if the pulsations in both hands are symmetrical from each side, which they are. So I'm going to go ahead and let the patient turn back to front, and we are going to repeat those exact same things from the front. So the middle lobe of the right lung, we can only hear from the front. So we'll be listening to both the upper lobes and middle lobe of that. And you can breathe easy for me. And here we most likely will be hearing bronchial lung sounds. So again, same thing. Go ahead and repeat blue balloon for me.
Blue balloon.
And again.
Blue balloon.
Great. And I'm going to finish this assessment with the percussion of the front. So overall, normal findings for a healthy young individual. I can go one step further, and when you're talking anything with heart and lungs, you're also concerned for any for the vasculature of the rest of their body, and it can give you some ideas on how their heart is pumping and how much oxygen is going through. So looking at the skin for any signs of cyanosis, you would see this around any of the mucous membranes especially. And inspection of the fingernails is actually a great way to see their lung and heart status. So what you want to do with the fingernails is you're looking for capillary refill. By pressing it down and letting go, you want to see that it turns from that white color back to that pinkish color within 3 seconds. You can tell if it's sluggish or quick, and his are brisk to get back to that pink color. You can also instruct the patient to do one of these. So I'm going to have you go ahead and put your fingernails next to each other. There should be a little tiny space that you see, but that's really about it. And that can indicate, if the patient has any clubbing, it can indicate hypoxia. So that completes our assessment, and thank you for joining me today.